All right. Hi, everybody. And thanks for taking some time out of your day to come along and have a bit of a listen to, or meet Dr. Cam McDonald and have a bit of a listen to Cam and our discussion. Hopefully get you engaged in talking about digital first healthcare and in particular, the personalised health revolution. So I was really excited to get Cam along today. For those who haven't heard of Cam before, Cam is a dietitian, an exercise physiologist, and a PhD scholar, and a leader in personalised health. And what Cam is doing with the Precision Health Alliance is talking a lot about how the knowledge that Cam and his team have developed over time, that's based on research around body types and genetics and environmental influences that promote health, can actually be used to tailor experiences for allied health professionals in how they can get the best outcome for people using this knowledge. And part of that journey is also being infused into the ever-evolving world of digital health and how the engagement with clients over time using digital tools and having knowledge that Cam is sharing can really make a big difference in terms of the commitment, the behavioural changes that are needed, can support the outcomes or the goals of your clients and what you're trying to actually achieve for them. So today we're going to just work through a bit of a run sheet, which is a quick introduction, which I've already gone through there with Cam. Cam's going to share some of the fundamental principles of personalised health and how the Precision Health Alliance that Cam represents can support allied healthcare professionals to know yourself, know your team, and know your clients. And then we'll sort of break out into a bit of a discussion where I'll be talking to Cam around how the digital first healthcare ideas and thoughts can really provide some real benefits that health professionals are able to use and implement, taking advantage of some of the stuff that the tools that Cam is able to support with as well. And that will follow with Cam sharing a sort of a proof of concept story on how an allied healthcare professional has been able to integrate into their practice these types of skills and knowledge. And then we can break out into a bit of a Q&A session before we close, and sort of estimating we'll probably finish up here by about 1:15. So if you're having some lunch, hope you're enjoying it. If you're having a coffee or a bit of a bevy, if that's applicable to your day, sit back and relax. Feel free to engage with us via the chat, and let's get started. So Cam, thanks for coming along today. I'll just shut this down. Just give me a moment. Got the opening screen up still. So just bear with me. There we go. All right. So Cam, perhaps if I haven't left out anything, give us a little bit of an introduction. Tell us a little bit about yourself and your journey and what brings you to the Precision Healthcare Alliance that you're going to be talking about today.
Yeah, thank you so much, Yianni. It's been wonderful working with you on this project so far and on previous ones as we have. My background, I started out a very wet behind the ears person who was just on his gap year thinking, what am I going to do at university? And I jumped into exercise physiology because I love sports. As it turns out, my passion, interestingly enough, was diabetes by the end of that course. And I then followed and pursued that in nutrition, doing my Masters of Dietetics at Griffith Uni, and followed that further into clinical practice, ended up doing my PhD, and then started working in private practice. And when I got out into private practice, it was the first time that I was really being judged on the results. At hospital, a dietitian's role is just to make sure that they eat food, and if they don't, it's the medication's fault. And when we started going into, obviously there's a lot of other functions of an on-ward dietitian, but when I got out into private practice, that's when it became, people are paying their money, I want a result. And I was providing guidance, which I thought was great because I was doing my PhD on lifestyle medicine and learning about lots of different things. And I thought I was giving the absolute best advice, all of the literature was sort of condensed down into these very simple things that I was working on people with. And some people weren't getting results, other people were. I started looking for why is that. I started blaming clients. I started, maybe doing a bit more research and thinking, do I need better devices? Ultimately, it turned out I started looking into genetics and personalization, and it was at that point that I found what's called PH360, Personalized Health 360, which is really it is the leading technology on the planet for personalizing health and understanding how you are different and how you are different to you even right now in this moment, and what that means for your requirements. And so I was very much engaged in the mission, which I'll share with you, of that organization. And from there, I've been teaching health professionals, doctors, allied health, fitness professionals all around the world on how we can understand people and their biological variation, how we can put that into something tangible, but how it doesn't mean just better results for clients and more consistent results for clients, but also how you can take something from it and how you can really support your team as well, the colleagues around you. So that's a little bit about me. It's just, as I said, it's really great to be talking to you today.
That's great, Cam, and I think it's important that you've got that empathy and background in having been actively a health professional out in the field working with clients, and kind of now focusing more of your time and effort on how to support health professionals with their own ways of understanding themselves and understanding their clients, understanding their teams. Why don't you share with us a little bit about what are these fundamental principles of personalised health and how that gets translated into day-to-day life for health professionals?
Yeah, terrific. So where I'd start is probably with the mission. And our mission is to eliminate chronic disease and pain by the year 2050. We believe that happens by firstly understanding people are different. That's very important, that everybody is different. And it's our strong belief that health professionals are a key part of not only helping people understand how they are different, but also how to implement it. And we support personalization and precision health in health professional practice, but then them going into corporate wellness, parenting, personalized learning, fitness and gyms. Essentially, we want to touch people wherever they are to ensure that they're able to understand what's going to work best for them. And when you have a reflection, everybody out in the crowd right now, if you're a health professional, why do we do what we do as health professionals? I could very much consider myself a health professional, even though many of my duties are business related now. One of my guiding statements that is an amalgamation of working with thousands of health professionals and their passions. It's to provide individuals with the knowledge and support to create and maintain healthy behaviors resulting in their best health and happiness. And ultimately, it's people feeling great doing the thing that they want to do. And this has benefits not just for your clients, but for your career and also your personal life. The quotes that you hear that people want is, oh, I just want to improve people's lives. I just want to help. I just want a career that I love. My family's health is what I'm really interested in. So these things, it's not just about clients, but it's very much about clients, but it's not all about clients. We've still got to take care of ourselves, take care of the people around us. And really it's about having the right information and the right support. And the problem with this is the right information is different for everybody. And if you're not looking into genetic literature already and personalization literature, I recommend that you start, because you'll start to see that many of the interventions that we have that are standard practice are not appropriate for everybody. And this is really important. What works for one won't work for another. And the reason for this is that we have genetics. Now, even if you're an identical twin, you'll be one of the very few people that have the same genes as somebody else. But the environment that you've been exposed to that changes your gene expression will be different. And so even if you're an identical twin, you will still have different environmental influences that then change your phenotype. And so you will be different to your twin. You will be different to everybody else on the planet. You'll actually be different to what you were 3 months ago. You'll be different to what you were 10 minutes ago before Yianni spoke, because right now your neurochemicals are in a different spot to what they were 10 minutes ago. Your phenotype, which that's part of, is different every moment of every day. And this is the interplay that we call epigenetics, the environment and how it influences gene structure or configuration to change phenotype and what we express. And so what influences these components of our health. You know, if you're like I was, a dietitian primarily, exercise physiologist as well, I would be looking at these two all of the time. But then if you get someone who's very stressed at work, that has a big impact on their health. You have someone with terrible social relationships, that has a large impact on their health, on their food choices, on their motivation, even on their inflammation markers itself. We know that if you're in a room with very little lighting, it's very different to being in a room with lots of lighting. We know that if you are, so this is outdoors here, if you're outdoors and it's very polluted, that has a significant impact on your risk of infection, heart disease risk. All of the very polluted countries on the planet actually are more prone to certain diseases as a result of that pollution. We also know that your mind itself, and I just want you to think about the last time that you had a negative thought, this has a negative effect on your health, as does poor sleep. So all of these factors are associated with what makes a person healthy. And the problem is that we, as a result of our genes, we respond to these things differently. And so it's not just a matter of accounting for all of these things, it's a matter of accounting for these things in relation to us. And this is where we have this non-responder issue. People who are doing the work, they swear black and blue that they've been eating the right foods and doing the right exercise and taking the right things and practicing the right behaviors, yet they're not responding. They're not getting a result. And this happens in a lot more people than you would think. When we look at a lot of randomized controlled trials, 20 to 40% of exercise trials are actually littered with these non-responders, people who don't get a response. We see the same thing in dietetics as well. We see the same thing in psychology. CBT has a 35 to 45% non-response rate. This is your high volume HIIT training, which we would think is good for everyone. Only 31% are high responders with 35% unlikely responders. I want everyone to have a think as you're at your RPM class in the morning, you look around, a third of the class is unlikely to get a result from that class because of the way that their metabolism is set up and how their physiology receives that type of stress. We know people respond differently to nutrients. This is the graph of the same carbohydrate eaten by different people and how one person looks like they have diabetes after eating that food, whereas this person doesn't respond at all to that carbohydrate. And we know the same thing happens for medications too. Now, when I asked a group of dietitians at the DAA conference a couple of years ago, if a client isn't getting a result, whose fault is it? And everybody points at the client. They're lying about their diet history. They're not giving us the right, they're not committing hard enough, whatever it may be. We go to blame client for protection of ourselves, but also, you know, I'm giving the right advice. Why is this person not changing? And then we look at something like this. We took a group of type 2 diabetics that went through HIIT training in the morning, red line, or in the afternoon, blue line, and looked at their blood sugar levels. Now you can see this, the red line, if they do HIIT training in the morning, their blood sugar levels are higher all day long as a result of that training, more so than no training at all, the gray line. So them doing a HIIT training session in the morning was actually worse for their body, blood sugar wise, than it was doing nothing for their blood sugars. Whereas if they did that same workout in the afternoon, they got a significant reduction in blood sugar levels. So when we do exercise actually matters. And this means a lot because we're not always thinking about this. This could be one of the reasons our clients aren't getting results. We then have broccoli, absolute superfood, get involved. But then there's some individuals with intolerances to some of the chemical compounds. There's some conditions that some of the components of this food is not actually ideal for. This is not a superfood for everybody. Some people swear by 5 meals and 2 snacks per day, or 3 meals, 2 snacks. Other people actually do far better on 2 meals per day, and some of the literature in specific individuals is indicating exactly that. So what is best for individuals? Because it is different. We then have this very interesting body of research looking at how brains work. It's not just food and exercise, but how you receive information cognitively is based on how your brain processes information. Some people dominantly process through the front part of their brain, and so they are very analytical because this is the analysis part of the brain. Some people really use this C4 area a lot, which is designed for spontaneous coordinated movement. They love doing exciting, fun things in the moment, and they get bored by systems and processes. Whereas this individual right here, who uses their occipital lobe more dominantly, They are very visual in the way they process things, and they read emotions from your face. And they are very good at interpreting and understanding your feeling, and very good at being a chameleon, actually, to match your state as well. So where people use their brain, and this is something that is baked into our development and becomes dominant throughout our life, changes the way we interpret information. We then have some individuals who love the morning and some individuals who hate it. Some individuals are at their absolute best from 8 to 12 and get so much done, and others are just warming up by 11 and then cruise through the night and get all of this work done late. And then there's people in the middle. But if you try and test a night owl early, they get stressed, and it actually leads to lower energy, particularly in the afternoon, needing a nap, even symptoms of depression in some cases if you're chronically tired from waking up at the same time. So it's not just food and exercise, but even how our brains work with the timing is also very different as well. And what are you going to need to consider for your clients in the future? All of this stuff, all of it. You have to understand all of these different factors to make sure that you are accounting for this person in front of you. Because if they're not getting sleep, your food and exercise program is not going to work, or it's not going to work as well. And so you need to be aware of it. Similarly for these other factors as well. And so the expectation for you as a health professional is that you need to keep up with the more than 10,000 new articles per discipline per year. There's 2.5 million health articles released every single year. And you've got to know about it, because one of them is going to appear in the Huffington Post, and you're going to need to have read it and understood it and know how it fits into a person's treatment. And you're going to need to capture their genomic data and their metabolic data and their symptomology and behaviors in real time, and how they're predisposed to motivations and drivers. You need to calculate all of this in real time. This is what's expected. And so this is what we should be doing a whole lot more of, and that's spending time coaching, spending time creating rapport and developing relationships, rather than having to calculate all of this information and spend an enormous amount of time just trying to get the advice right. And this is where technology supports us. It started with a microscope, and now we're doing genomic assays that are processing tens of thousands of chemicals in a matter of minutes. We're looking at wearables that are able to understand the inside of the body in real time and have interpretable data that we can use. We have these incredible machines that are wonderful at imaging and essentially intervening very accurately, very precisely. Technology is here to help us, and every addition to technology has only been better. And now what we can do with technology, we've spent the last 20 years calculating genetics, anthropometric data, a number of other phenotypical factors. And we started with a tape measure, but now the technology is at a point where you can understand a person's embryological development from a photo and understand dominant hormones and behavioral traits, even nutritional requirements. We then add things in like hair color, eye color, skin tone, markers of collagen metabolism, genetic lineage, medical and developmental history. All of this goes into the platform and then calculates based on where do you live right now? Did your genes develop in Northern Europe? Because if you're in Australia, then we need to prevent melanoma. What are the nutrients that are relevant for that? Well, based on your hair color, eye color, and skin tone, your calcium regulation is like this. Your vitamin D regulation is like this. What are some of the foods that are going to help balance that out? And so these are the very complex algorithms and very complex calculations that we don't have to make, but rather can be calculated within 10 to 20 minutes of assessment using technology to understand how is this person different, and how does that difference present a tangible change that they can make. And so this is what an individual's profile looks like in the back end. These phenotype characteristics have been mapped back to single nucleotide polymorphisms and back to the chromosomes and genes, so that we can understand within your smartphone, without sending off bloods and saliva, how you are different right now. And when your location changes or when your waist circumference changes, it'll track that and then give you an output that's updated based on a different hormonal profile that you will have as a result of less inflammation, etc. And so this technology provides this information across all of these disciplines that we've spoken about. It's being used in 140 countries right now. We're using it for research in in reversing diabetes, reversing cardiovascular disease, which I've done personally in practice. And ultimately, it enables health professionals to bring this incredible intelligence into their business. So they know, what is this person suffering from? Why are they suffering from it? What are the key areas to focus on? How are they going to be driven behaviorally? And how can I understand more about myself as well? And so I know I've gone a little bit over the 10 minutes there, but these are the principles of personalization that are very important to understand to really get a good foundation of what is expected of you in the future as a health professional. And the digital healthcare piece is exactly here to support you in that endeavor.
That's great, Cam, and really eye-opening stuff. I really like that sort of last comment that you're sort of talking about there around the that complexity being simplified and how the technology is using that. Not that I'm a health professional, but I was sort of thinking about what it would be like to try and synthesize a lot of this information and kind of introduce it into your workflow on a day-to-day basis. What's your recommendation, or how does this actually play out in practice?
Sure. Really, I've got a slide that kind of gives a bit of an understanding of that. And so essentially, if you've got a client who comes in, she looks very happy. Not all of them are that happy when they walk into your practice. And I'm going to take this from a ex-phys dietetics standpoint, and which is quite transferable to most environments. What you know about a client before the session is you might send out a pre-screener, you might have some basic goals from a phone call with them, you might have an understanding of what disease they have, you might have a basic screening. When you get into the consultation, you need to then gather clinical history, body composition, physical observations, send them off for bloods. If you're doing things personalized, you'd be sending off for genomics. You'd then be getting a feel for their mindset. You'd be building trust. You'd be calculating all of that information after it comes in over the next couple of weeks and relying on them to get the tests done. You then create the program that you're thinking about, and then you deliver it to them, and then you test it, you evaluate it, you refine it, and you get to know your clients' nuanced behaviors and preferred communications over a number of activities. So this is the pretty normal standard practice stuff that we would have as a relationship with a client. What happens when you can put someone into this health platform? Essentially, you get all of this stuff on the left, but when they enter their information, which they do at home, they can actually take the photo themselves, fill out the medical questionnaire themselves. Once you're trained in this, you actually have an understanding. If they have diabetes, you know why they have diabetes. You actually know the reasons as to how their body has gone out of balance based on the information that's provided in the health professional platform. So before they've even walked in, you understand the driving cause of their disease, because we understand causation when we start becoming more precise. You will actually already have the information on specific nutrient requirements, movement-based things that are recommended by the lifestyle medicine engine in the application as well, which is incredibly precise. And then you're able to tweak that with clinical considerations before you even meet them. You will also have an understanding of their predicted motivators and stresses. So is this person going to be a data person? Are they going to be a relationship person? Are they going to be a person that brings you brownies at the end of at Christmas time because they've just loved you, even though they haven't got many results, but they just love hanging out with you and they're this really generous person? Or are they here just for a result? They want data and they want results and then they're out. You will actually have a prediction on how their mind will work based on how the information flows through into the health professional panel and how the app is able to predict that very accurately. You will then have an understanding of, do I need to create a 5-session package for this person, or is it a 2-session package and they just want high value, low touch, and then they're out and they'll be autonomous? Or are they going to need that 12-week support? Because these behaviors and motivations actually change based on how people are built biologically. And if you're wanting to understand more about this, you can look into behavioral genetics as a good starting point. And then what's the most resonant communication style? So before they even step foot in the door, they've done the assessment that they can do at home. You now have information on all of this. And so you confirm and explain the clinical history. You then build trust because you know how to speak to them and the kinds of processes that are going to be most appropriate for them as well. You then are able to provide specific interventions straight away while you're waiting for bloods, and you can maximize adherence through the right consultation style. So by them having tech first, it allows you to have an understanding of them in a much deeper way than if you did this manually as well. With and considering the expense of all of these tests, this is actually an incredibly affordable option for your clients to get all of these various things done very, very quickly.
That's really great. I think that the context difference there in that slide that you got up there between the gathering versus confirmation and explanation, I think that's, to me, that feels very intuitively powerful, because you're coming from a position of almost demonstrating that you know something about this person already. Yes. And I can imagine from a client experience standpoint, that would be a very positive experience. Because you're not having to go through, I guess, some of the pain points that clients go through in terms of trying to fill in forms and provide a lot of disclosures about themselves.
Absolutely.
And not really know what that's going to deliver in this first appointment.
Very much so. And many of these people are bounced around from person to person and have to repeat their history every time. And it's just this, they're constantly reconfirming about all the things that are wrong with them, when you actually just want to have them in a really great state of it's action time. We know what to do. And you can use your clinical expertise to say, hey, okay, so I saw these outputs. Great. I'm going to apply my experience here and really shape that into something that's going to be completely appropriate. So yeah, I'm really glad that you got that, because it's that idea that you get to hold that state of expertise, but really you're able to leverage incredible technology. It's like trying to take an MRI yourself with your eyes. It's very difficult. If you don't have to do it with your eyes and you can do it with a machine, you would definitely do it with a machine. And this is it's calculating all of the different complexity that we have about an individual can be done so much faster with technology these days.
Yeah, it's really fascinating. I'm wondering whether there are any opinions in the attendees today, because we've got quite a broad number of health profession types represented, covering mental, physical, nutritional health professions. And when I think about the fine art of digital first healthcare, it's about actually improving the human experience for everybody involved. So that we sort of get to rapport very quickly, we get very pragmatic and into whatever's defining success for that person. What is it that's driving them along the way? And I think you talked a little bit about that in the prevailing model is to try and get a feel for mindset and to build that trust. Whereas if you're coming from a position of demonstrating that you intuitively know quite a lot about this person, even though you've only just met them, you're getting through that rapport and you're getting to that understanding of what would be a better fit for them. And you also remarked on communication styles, which is sort of coinciding with that. But tell us more about that rapport building and how we actually then, aside from the health tech and that digital first kind of model, being able to collect information and be able to support the prediction and the empathy around who this person is. But then in terms of being able to train and support a health professional to be able to utilize the tools and that information to be able to go beyond that first contact, that first rapport, and be able to work with the right communication style for this, person or this physiology, this body type versus that, and so on and so forth.
Absolutely. So for those who haven't explored too much about the behavioral genetics or the hormonal influences on behavior, what is really interesting to understand is that during the times of embryology, there are certain organs and certain hormones that become dominant, and they actually have a persisting effect throughout our life. There's a butterfly effect from embryological times that influence how we grow and develop. And a really simple example of that is your ring finger versus your index finger. If you have a difference, or most people have a difference in their length, that's actually being determined embryologically based on your testosterone and estrogen levels. And so what happens in embryology changes the way you develop. But what we also know, it's not just a matter of changing the inconsequential length of your finger and how long it is to actually get an engagement ring on there, but rather we also know that this is a trait that is shared by the majority of elite athletes, because higher testosterone creates a longer ring finger. Now, if you've got a persisting higher sensitivity to testosterone throughout your whole life, you're more competitive, you're slightly more aggressive. You don't mind a bit of confrontation. There'll be often you'll want to do things first and do them well. And I will say that this hand is not the only marker of this. There's a number of things that actually make this. But we know that if we come across someone like that in our practice, we know that setting them a challenge is going to be really important for their motivation. If you go, oh, we're just going to follow this for the next 6 months and we're just going to do exactly this process, they go, oh, where's the challenge in that? I know exactly what's going to happen. This is kind of boring me. 6 months, that's a long time to be racing. But if you say, hey, are you ready for a challenge? Because you know that they're a little bit up for a challenge. And they go, yes. You go, great. We're going to do this for the next 3 weeks. The last person did it this well. I wonder how well you could do it. And all of a sudden, they don't even know it, but their natural levels of testosterone sensitivity start getting triggered in a really positive way, and it moves them into action. Whereas if you take somebody who has a different hormonal profile that are generally more nurturing, you'll find this with higher prolactin levels, higher IGF-1 levels, insulin resistance is often common for this as well, slightly lower thyroid function. You'll have a body that's bigger, but that body that's bigger is also more caring and more nurturing. And so when you're supporting them, you go, do you want a challenge? And they'll say, sort of, I think, you seem excited about it, so I'll do it for you. That's their mentality, is I'm going to do it for you. Whereas the best way to support them is say, hey, I am here for you for the duration. I'm committing to you like I would my family. I've got your back. Join our community. Come out for a cup of coffee with us. Because these prolactin hormones actually make you very socially oriented. And so if they feel like they're around people who are interacting with them and connecting with them, that makes them feel safe. That makes them stick around. And that's why they need a 6-month program of coffee catch-ups with a bit of information, rather than the testosterone person who wants to just get a challenge in and get it done and don't really care about everybody else unless they're winning. So this understanding that how you develop rapport actually depends on the kind of package that you provide, on how you talk to them about it. And by you knowing their profile and just treating them in the way that their biology is asking, they just feel safe with you. They feel like this is the best place ever. And that's very, very powerful. So that's a little piece on, and there's many, many variations to these hormonal dominances, lots of different personality profiles, but it's all grounded solidly in genetics and hormonal personality hormone science, which has been happening over the last few decades.
It's really fascinating stuff, and I've got so many questions, but I'm also mindful of how much time we've got left. Maybe I can sort of ask a question and lead into the POC and what you've discovered.
Sure.
Are there sort of some rules of thumb that generally work? It's probably a two-sided question. On the one hand, I was thinking, do health professionals self-select their clients in a sense because of who they are and what they feel comfortable with? And if so, is that a limiting factor to success, that a health professional and a clinic could actually, by mastering some of this knowledge and being able to actually work outside of their comfort zone by knowing more about their clients, that they would actually be able to have success with perhaps clients whose personality types aren't a natural fit for them?
Yeah, that's a really great question. And ultimately, health professionals will do lots of different things. If someone really feels like they're in mastery of their profession, then they'll see lots of different people. What we find is that new people come out and say, I'll see everybody. And then they go, no, I really like seeing these people. And then you either specialize or you become generalized. And so what we'll find, though, is depending on the structure of your consultation, you can sometimes just get away with being yourself and people put up with it. But generally, there's always going to be an element of you that sets somebody else off in a negative fashion, just because you're different people. And we definitely see this with health professionals who go through the training of understanding, oh, this is how I am. And that's how it's been received by them. I can totally see how that wouldn't match now and why my clients weren't getting it. For example, I'm a very knowledge-based brain. I like to understand things very well. And I think that everybody, if they understand it, they'll get it and they'll do it. But that person that we spoke about, that very social creature, they don't care about the knowledge. They just care about that they feel supported. And if they feel supported, they don't need the information why. They just will do it because they trust you. And so I would spend half an hour in my consultation dumping information on these individuals, and they go, oh, that's really lovely that you like that so much. You know, that was the feeling of their response when all I needed to do was ask them questions about their family and make sure that they felt really connected. And I said, okay, cool. What we've got to do, can you do this for me? And they say, yeah, I'll definitely do it for you. And that level of, I actually got better adherence doing far less explanation because that's what that person needed. So you'll get some big light bulb moments in all of this. And I'll probably fast forward to one of the POC pieces. And this is where we started looking at the marketing side of things. Because not only will you start seeing much more consistent results because you're actually giving people what they need individually, that I found really led to a whole lot more word of mouth referral. People would say, I did this thing. I've got exactly the foods that are right for me. I've got all of this information about my personality. I've got a health professional who's actually setting up a package for me specifically. And they'll say, oh, geez, I've got to do that. And it's amazing how that really generated word of mouth referral. So the consistency, the uniqueness to the information, I really see a lot of our health professionals improve their own health. Not only do they get to tweak the knowledge that they have of their own profession with that personalized lens, but they also get to learn so much more about the other factors that are driving health as well in a practical sense, in a personalized sense. And so then we created one of our, both of these are Avatar 2, but obviously that's a copy paste, Avatar 1. Avatar 1 is this prolactin dominant, very social creature. They're behaviorally, they are nurturing, steady, reliable, selfless, and caring. And so from a business point of view, this person is going to want a 6-month program that's social, with a chat forum, with coffee breaks with everybody, with social walks in the morning, with connection with people, bringing their family into the program. This is the thing that's going to mean so much to them. And we got our health professionals to actually just run a couple of different niche marketing opportunities. And one of them was, come along for the ultimate support, be around people that just want to make sure that you feel the best you ever have and feel lighter and you're cared for, and 24/7 support from the team. All of the language was about support, because this is what this body naturally tends towards. And guess what? 25 of 26 individuals were this very specific person that they were aiming for. And so the language that you use absolutely makes a difference. And this then allows you to niche down to say, hey, I actually want to work with people, and we've got coaches like this. They're like this. They're adrenaline dominant. They only want to do things for 2 or 3 weeks at a time, maybe 4 weeks maximum. And so what they do is they say, hey, I'm going to call this the Epigenetics Express Challenge. And it's going to be 4 weeks of high intensity. You're going to get all of the changes that you want to see. It's going to be competitive, You'll share all your wins, all of that sort of stuff. So lots of competition language. And guess what? We had 98% of the people who turned up were one very specific type, this adrenaline type. So not only is it about people attracting a certain niche, but you can specifically attract a certain niche and also understand, why am I not attracting certain people? Because what's really fascinating about this as well is these hormonal dominances also relate to similarities in disease predisposition. So you can talk to a disease and a specialty in certain conditions and attract people the right way so that they actually are going to want to come and join the thing that you're doing. This is what's very, very powerful. And obviously, the beauty of technology as well is that it's scalable, but it's also something that can add some bottom line to your practice. It increases the additional dollar per client. Now, I know we're not all in it for money. However, your business manager is, and your CEO or the owner of your practice has to keep an eye on the dollars so that they can pay you, so that they can pay rent. And if you've got 30 clients who turn up and all increase the amount of money that they're spending with you, this is also incredibly powerful. And it means that it's easier for you to retain them because you know what's going to keep them around as well. And so all of these insights can then be applied to yourself and your team, knowing the strengths of your team. And this is what's really powerful about this whole picture.
That's great, Cam. And fantastic. We could talk for hours. I think I'm so intrigued by this. I have a sense of personalized through the design of health tech and kind of implementing digital tools and the whole software development process. So I draw some parallels between our two worlds, so to speak, in how how they kind of overlap in some ways, but having this linkage towards those genetic and aspects of differentiation between people, and how that actually plays itself out in what motivates somebody, what kind of stresses will be more effective to one type versus the other. How do we build rapport? To me, that seems like a fantastic set of both quantitative and qualitative skills, or hard and soft skills within the areas of delivering healthcare practice. I wanted to just provide an opportunity if anybody had any additional last-minute questions to put them through right now, so we can cover those off before we wrap up. But Cam, for those who are watching this, how can they get in touch with you, and what are the coordinates to sort of reach out to you and engage with you and find out more about how that can be implemented within your practice, within even dealing with recruiting and team members and building a practice? There's a variety of ways that I see this type of knowledge and skill to be applicable in a modern health practice.
Yeah, absolutely. So probably the first and foremost, we've just gone through a rebrand. We're now called Precision Health Alliance, but you'll also see this website right here will take you to the very basic, the foundational place where you can get some free resources. You can also investigate the courses that we run and understand more about the technology and the insights. There's a couple of free specials in there about non-responders and chronobiology, so you can really start to inform yourself. I would say if you're interested in the course itself and actually taking some action on that to bring this technology in and really be skilled up in all of really the future of healthcare, which is precision medicine, you can reach out to Gerard at ph360.me, and he will make sure that you find exactly the right solution for yourself. We also have an Instagram handle if you want to follow along with that, ph360hp. And obviously we'll be working with coreplus over the coming years, and obviously through them will be another avenue too. But ultimately, I would love all of you to just reflect on, what did I get into health professionalism in the first place? What do I want from my clients? Because what they want from you is exactly what's right for them. That's what they want. They don't want rough answers. They don't want generic templates. And while we do a great job of tailoring and personalizing based on their mental preferences, there is a whole lot of work that we have to do in the baseline biology of an individual, that if we tap into that, you will see more profound changes than you will have ever seen before. And I say that with a very skeptical mind, with an academic mind that tested this very thoroughly for a year back in 2014 before really feeling confident to really bring everyone on. But it's been so consistent and so powerful. And once you start learning about this information, you can't unsee it. It becomes part of your everyday life to know that people are different and how you might be able to respond to them differently as well.
Thanks, Cam. That's really appreciate you coming along today. For those who are in the live stream or watching this in a recorded version, the Practice Happy community at coreplus will feature a clubhouse talking about personalised healthcare. Dr. Cam McDonald and some of his team will be interacting with that, and also providing some additional content from time to time. So it's a great way for you to indirectly connect if you're part of the Practice Happy community at the moment. Or if not, you can join the Practice Happy community via the coreplus platform, or pick up on the coordinates that Cam has already published here to get in touch with Cam and find out more about personalised healthcare. We'll continue to work on how the health tech aspects of personalised healthcare can be integrated with the clinical and practice management side of things over time as well. And we're really looking to see some of the coreplus user community now adopt some of this and continue to support the information set that Cam is talking about there in terms of the success that's being experienced out in the healthcare arena. So Cam, once again, thank you very much. And thanks for everybody who gave up some time to come along and have a listen today. Really appreciate it. Have yourselves a wonderful day. Thank you.
Thanks so much, Yianni.